Kayla. I'm going to be your nurse today. I'm Mrs. Jones.
Yeah, Mrs.
Miss Jones.
I made that mistake over there.
All right, be your nurse today. Have you ever had a catheter before? Are you allergic to iodine, shellfish, latex, anything like that? No. All right, I'm going to check your armband. I'm going to make sure that is the patient you have an order for it. All right, I would pull back the covers to get them out of the way, and this would not be open yet. All right, I'm going to see if they need cleaning. If they do, I'm going to put on some clean gloves and do my whole perineal care. All right, they're good, so I'm going to put the patient into position. And if you have somebody in the room with you, it's not that big of a deal, but if you're draping them like this, you got to remember to remove that gown before you get sterile. But if you're in here with me, you can move it. I have messed up before and got sterile before and had to kind of use my elbow. If the patient's with it, they can pull it out of the way. But keep them covered as long as you can. Then you would open your kit. This is going to be my trash bag. We have this for my sterile gloves. Now this would not be open like this. It's going to be wrapped up pretty. I'm going to come right here. I would have done hand hygiene. I do not have on gloves at this point. Alright, I open away from me, side, and toward me, making sure that I do not cross over. If you want to straighten it, you can, however you want to do it, as long as you're touching the 1-inch non-sterile border.
And it can touch her foot like that? Because it's the back, right?
It's up under it, so
okay,
yeah. You wouldn't want to put on top of it. Alright, so now I'm going to grab my drape, which is in here backwards, but we're going to make it work.
That's how mine was too.
Alright, shiny side down, so I let it fall. People do this differently, but I take mine, I hold it from the corners, and I do this number. Alright, if it falls right there, I'm okay until I get sterile. Alright, I'm going to get my gloves. You can do it on the side of the bed or on the bedside table, but you cannot put them on the sterile field because you can't do that, yeah. Alright, I'm not turning my back, so I'm good. Pinch, straight in, and then scoop, and straight in. And I can leave that there because I don't need it. Now now that I'm sterile, I can do this, but I want to make sure that I'm not touching her bottom. All right. Now set up your field. I choose to do mine like this. Whatever works best for you is fine. I don't want that. I'm going to open up everything, so I open my lube. Will you give me that lube right there? All right, so pour that. That would be what I just poured out. Open this, pour it on the cotton swabs, throw it away. And go ahead and hook this up, but don't test it. Now what I do, I go ahead and take this all the way off. You just want to make sure that it's not flopping everywhere.
That's the only thing I did wrong.
And stick it into the lubricant, and it should stay. All right, now everything's set up. I'm ready to go. I'm going to take my non-dominant hand, and it is now dirty. So you pull the labia apart, grab your tweezers and your cotton swab. You're going to go away from you, and this is your exaggeration. Do the little box number, and then in the trash.
If it does that for checkoff and it doesn't go in, are we going to get in trouble?
As long as it's not on your sterile field.
Okay.
All right, towards you, and throw it away.
Nice shot.
And down the middle, and then throw it and your tweezers away, and make sure it's looped up. You don't want to hold way back here because it's going to be floppy, so hold about right there, and insert.
Do you tell them anything? Hey, I'm about to insert
You
it?
can.
Okay.
Yeah, you might feel a little pressure. All right, then you keep going, and then you're going to say, or your instructor's going to say, okay, you see urine, and you'll literally see it going into the tube. And then I go 1 to 2 more inches. Now I pinch with these fingers. That's okay because we're not this in. All right, inflate it to the amount that your catheter says. And you want to make sure that you hold pressure right here, let go, and undo it, and then give it a little bit of a tug to make sure it's in there. Alright, at that point, the sterile part's done. It's in. You put this on a non-movable part of the bed. If you need a urine sample right now, you're gonna get it from the bag. If you need it later, you're gonna get it from right here. Sometimes there may not be urine hanging out right there, and you may have to clamp it off for like 20 minutes and come back in here and pull some out.
How do you get it out?
You get a lure lock syringe, just a regular syringe.
Oh, and it clicks and you pull.
Mhm.
Okay, I understand.
Alright, and then this is your stat lock right here that you're going to put it in. Which is,
That's already like on the mannequins though, right?
yeah, it's on the mannequins, but it would be in your catheter kit in the hospital. You just stick it on your patient. And that keeps it from tugging. That's it.